The Sepsis Advisor is the last part of a collection of tools to facilitate the rapid identification and treatment of septic patients. The first part is the St. John Sepsis Crawler, which continuously reviews laboratory and vital sign data in the cloud to identify patients who may be developing sepsis. Here is the most current version. Crawler fires two types of alerts: SIRS alerts for patients with 3 SIRS criteria, and sepsis alerts for patients with at least 2 SIRS criteria and at least 1 organ dysfunction criteria. When the alert fires, the nurse will receive an on-screen notification even if they are in another patient's chart. It will recommend for them to contact the provider and/or RRT for further evaluation and treatment. If the patient has a sepsis but not a SIRS alert, there will be a dialog box that will be displayed when the patient's chart is opened by the provider. The dialog box shows the criteria that caused the alert to fire and has 3 options. The first option is to launch the advisor. We'll discuss the details of that in a moment. The second option is to open the chart, which will simply dismiss this alert and open the chart. There will be no suppression of further alerts, and if the chart were to be closed and reopened, the dialog box would display again. The third option is Document Reason Treatment Not Indicated. There are 3 options from the drop-down for this section. It is important to note that documenting any of these reasons will suppress alerting for all providers, including nurses, during the time frames specified. The first option is for comfort care orders, which will be a 6-hour suppression. The second option is suspect non-infectious cause of abnormalities, which will suppress alerts for 24 hours. The third option is immediately post-op, which will suppress alerts for 6 hours. Going back to launching the advisor by clicking this button, we can also place an order for the Sepsis Advisor at any time simply by searching for Sepsis Advisor. The Sepsis Advisor has 3 sections: Evaluate Patient Risk, Select Recommendations, and Document and Sign. In the first section, the first item is the Current State section. There is a drop-down here for a category for the providers to select. Providers should select the appropriate category between SIRS, sepsis, severe sepsis, or septic shock. To the right, the most recent alert from the system is displayed. In addition, the hyperlink shows the definitions used for these classifications. Allergies are shown in this section. Recent relevant results, including white cell count, bands, creatinine, and most recent lactic acid, are shown in this section. Antibiotic orders in the past 90 days cross-encounter are shown in this section, such that if a patient was admitted 2 months ago and received IV antibiotics inpatient, they would be displayed here. Additionally, there's the microbiology section, which shows the last 6 culture results. By clicking on the hyperlink, you can also see the susceptibilities. Additionally, you have the most recent vital signs for the past 96 hours. In the second section, Suspected Infection Sources, the provider should select up to 2 suspected sources for infection. For this example, we will use septic shock and a suspected source of intra-abdominal. Selecting the Select Recommendations button will open up the Select Recommendations section. The first item in the Select Recommendations section is the Currently Active Relevant Medications, which will show current antibiotics. These can be discontinued from this section. There's an option to document a broad-spectrum antibiotic was initiated prior to the onset of septic shock. The next section is the Special Dosing Recommendations. The creatinine clearance and estimated creatinine clearance will be populated from the system. This information is used to categorize the patient into a renal dosing category. The provider can adjust the category to whatever is appropriate for the patient. The next section is the antibiotic recommendation section. there is an option for penicillin allergic and non-penicillin allergic patients. Clicking the radio button will select that option. The next section is the fluid therapy recommendations. There are orders for normal saline and lactated ringers, 30 ml per kilogram boluses. There is a sepsis IV fluid modification assertion, which does not qualify as an exemption for quality reporting, but does identify that fluids were given with a consideration of medical circumstances that may vary from standard guidelines. In the diagnostic studies section, there are a list of commonly ordered diagnostic tests. If there is already an order or a result, you can see that in the documented section. Clicking on each checkbox will place the order. There are also orders for consult to critical care. The last section is the vasopressor section. This will only show up for septic shock patients and show norepinephrine as the recommended first-line treatment by surviving sepsis guidelines. Clicking on the box and then selecting confirm will bring you to the confirmation page, which will show the summary of all the orders you have selected. There is also an option to add septic shock to the diagnosis list. Clicking sign orders will take all of these orders to the scratch pad, which completes the advisor.